Most men are aware of testosterone deficiency and have an idea of the issues that it can cause, especially those associated with sexual function and muscle health. But a lot of men are unsure whether they should seek treatment. It is true that many of the symptoms of low T share similarities with what has long been considered a part of natural aging. But if you are growing older and you feel your body start to slow down, testosterone therapy may be an option for you. Of course, testosterone replacement is a medical therapy just like any other and has its own risks and side effects. Although low T treatment with testosterone has a solid safety profile, there are some question marks associated with treatment. And before initiating therapy, you should consider taking steps to improve your health and testosterone levels through lifestyle. Testosterone deficiency is a real medical condition, and andropause is an increasingly accepted aspect of male health and aging. Andropause is an umbrella term which refers to the collection of symptoms of low T that manifest themselves as men grow older. Testosterone levels drop slowly starting around the age of 30. This natural decline occurs at a rate of about 1% per year. But this steady decline represents more of a peak baseline that your testosterone production can naturally reach. There are a wide variety of factors related to your lifestyle, nutrition, and activity level which can suppress testosterone levels further, not related to aging itself. For example, testosterone is produced mainly as a response to physical activity, especially anaerobic activity. If you don't get enough exercise, your body won't provide enough testosterone. The same with sleep. Your body produces a significant amount of testosterone while you are in deep, sound sleep. If you aren't able to sleep soundly through the night, this will inhibit your body's ability to produce testosterone. Often, testosterone therapy is prescribed to men that could benefit significantly from altering their lifestyle and picking up better habits, rather than starting up with bioidentical testosterone treatment. Testosterone replacement as a popular medical treatment is relatively new. Men have been using testosterone for low T for decades, but the body of clinical research has lagged somewhat, leaving some questions. Estrogen replacement therapy has been used clinically for decades and is heavily researched as a result of menopause having such clear and apparent effects on health and psychology. The underlying issues resulting from testosterone deficiency have been recognized much more recently, and physicians and researchers are still discovering more underlying implications of the condition. Although it seems more than apparent that many men can benefit from low T therapy, there is always the chance that new risks associated with treatment could be uncovered in the future. 30 years ago, estrogen treatments were provided to women heavily that were interested in alleviating the effects of menopause and postmenopause. But today, as the body of research and medical knowledge has grown, the way that estrogen therapy is used has changed in order to increase the effectiveness, the safety profile, and the overall benefits of treatment. It appears that testosterone therapy is undergoing the same clinical evolution today. In the past, bioidentical testosterone was often prescribed alone, without any other form of additional therapy. Research began to find that, when administered in this way, certain groups of patients were more likely to experience side effects related to treatment, some of which were dangerous, including some cardiovascular severe issues. Modern research is showing that most of these risks associated with testosterone therapy are not the result of testosterone itself, but the result of the way that bioidentical testosterone, when prescribed alone, impacts other aspects of hormone balance. For example, some testosterone is always converted into estrogen. This is one of the primary ways that the male body makes the estrogen that it needs. The problem is elevated estrogen levels are associated with cardiovascular complications, and estrogen levels increase in correlation to circulating testosterone levels. Now, there is more and more evidence that suggests that these risks can be mitigated through the supplementary prescription of estrogen blockers, one of the most common of which is Arimidex. Estrogen blockers prevent estrogen production from reaching dangerous levels, which mitigate much of the heart risk associated with testosterone therapy. Second, there has been some stroke and clotting risk associated with testosterone therapy. This happens because testosterone encourages the production of red blood cells, which can overcrowd the circulatory system and increase the risk of many cardiovascular issues, such as stroke and heart attack. This issue can be treated effectively by donating blood. These two preventative factors, along with regular appointments and health monitoring, are quickly becoming routine aspects of treatment and will become increasingly recommended, especially for certain at-risk groups, in the coming years. Testosterone therapy also has a noted impact on fertility, as it has long been known that bioidentical testosterone therapy suppresses the ability of the testes to produce healthy concentrations of sperm. Of course, like the previous issues associated with low T therapy, there are ways to mitigate this side effect of treatment. There are multiple ways to increase testosterone levels while preserving fertility. For example, by combining testosterone with human chorionic gonadotropin, it is possible to increase testosterone levels while sustaining fertility, as well as the form and function of the testicles. Clomiphene citrate is also prescribed off-label on its own, both to boost testosterone and increase fertility. And N-clomiphene citrate is undergoing the FDA approval process as a treatment for fertility. Of course, there are other issues associated with testosterone therapy that should be considered as well. For example, testosterone therapy can encourage prostate growth, which may lead patients with a predisposition to prostate issues to perhaps avoid the therapy or at least use it with caution. Also, patients with sleep apnea should be cautious regarding low T treatment, because testosterone treatment does have the noted effect of complicating sleep apnea in some patients. Although there are still as of yet unanswered questions regarding the long-term safety of low T therapy, it is quite clear that a large subset of patients in the United States can benefit significantly from low T treatment. If you are interested in testosterone therapy treatment, it is essential to see a medical professional that can assess your needs. Don't try to take testosterone under the table or for purposes other than the treatment of clinically diagnosed testosterone deficiency. To qualify for therapy, you must both show symptoms of testosterone deficiency and have medically low testosterone levels as determined by blood testing and diagnostic analysis. If you are eligible and your doctor decides that you can benefit from treatment, he or she will discuss treatment options and determine a course of action that is right for your needs. Make sure you discuss additional treatment options such as estrogen blockers to make sure that you get the total care that you need. If your testosterone levels are borderline or somewhat low, consider altering your lifestyle habits to naturally increase your testosterone levels. For many patients, this may be all that is needed to improve health and wellness, because the patient's testosterone deficiency in many cases is more the result of the patient's lifestyle choices than his age-related deficiency.